share your video. Amazing results. What did you think when you saw the pictures today?
Oh my God, I couldn't believe it. It was just like it was somebody else. I was so happy to see it.
After we do a treatment, our vision gets better and our memory gets worse.
Oh,
We forget what we used to look like. Let's take a look here. So we did the local anesthesia, image lift, facelift, right? The neck and the jawline. We also did some of the facial fillers building up in the cheek, and we trimmed a little bit of the eyelid skin. You look great from every angle. The neck used to be very full, and what a difference. Now what I want to show you here is notice how the apex of the face gets a little low as we get older, but now you can see her cheeks are more full and the apex is higher. And that looks good. That's what we want. So I'm curious, Liz, what was it that inspired you to say, you know, I want to do a treatment?
I guess after so many years, this was like part of our family where it was a little bit heavy here. And I always wanted to wear like a short haircut where I could see this side a little bit more lines in this area.
Yeah.
And I guess after some time, we get older and I was looking tired. I would look at myself in the mirror and I said, oh my God, I think it's time now. So that's kind of what inspired me after all, to come and see you.
We're so honored to be a part of this with you.
Thank you, Doctor.
How did you find us? Who referred you to us?
Actually, no one referred me. I was on Facebook and I was seeing all your results and I was seeing what everybody was commenting. And I was saying, well, you know, I guess let me go in and make an appointment and speak to him to see how this will work out for me. It looks so natural. I think that also inspired me. When I was looking at the pictures, it didn't look like a stretched out person on the face.
No.
It looks so natural. And so that really inspired me also.
Wonderful. And so you saw the videos, was it pretty much what you expected based on?
Absolutely.
Yeah.
Absolutely.
So what you see is what you get, and we're doing a video now, so we appreciate you watching. So we're on a mission to stop bad plastic surgery. We want to help people know the right things to do. And so I'm curious, when you were doing your research,
yes,
when you look in the mirror, what was the feeling it gave you when you're in the
befores?
Yeah. You're looking at yourself and you're saying, how did it?
I was like, I need to give myself a chance to do this. I have to try this. I have to do it because those results on everybody else look amazing. I'm sure he's going to do something amazing with me too.
So proud, so proud. Now, if you're just now joining, so we did the local anesthesia facelift, we did some of the facial fillers, and you look at the jawline, the fullness through there, the incision's a little bit of red, that's going to fade. We trimmed a little bit of the eyelid skin. Now, you were mentioning you wear your contacts, and after we trimmed the eyelid skin.
I wear contacts, and I thought, well, how is this going to affect me with my contacts? But after the effect of having the surgery, I can even see better now.
Yeah, it feels less heavy up there.
Yes, absolutely. And I put them on, I was, wow, this is great.
Good for you. So comments from family or friends?
Nobody really noticed. I guess it was that natural.
It's not a small change. It's not a small change.
No, nobody really. They would look at me, but they were looking at me and trying to see what's going on with her, but nobody would comment. Yes, and then absolutely after I said, well, doesn't anybody notice? You know?
It's an interesting testament that people don't look at us the same way we do the way we look at ourselves. And it's nice we all want to get a compliment. Oh, you look so good. But sometimes if people don't notice, that's a good compliment because you don't want them to say, hey, what happened to you? Now, when you show them the pictures, then it's evident. I mean, this is the younger sister, this is the older sister, and we did some volume and fillers. So, and especially you see it here. I mean, the shape of the neck now, you have a jawline, whereas before it all came down. We have some patients that are on the fence. They're not sure about what they should do. What would you tell them based on your experience?
Don't think about it. You have to have this done. You're going to feel so much better. You're going to look at yourself in the mirror and say, why did I wait so long? I should have had this done.
Good for you.
Yeah, and you're going to be so happy with the results. It's so natural. Nobody turns and looks at you and stares at you. They just walk right by you. Well, you know, I would say do it. Don't think about it. Yeah.
Good for you. How was our team here?
Excellent. Team is the best. They are so warm. They're so friendly. They listen to you. They take the time with you. They explained everything to you. They're great. They're just great.
Wonderful. Thank you for sharing. And we got a little bit of the filler, so I'm going to show you. We're going to do a little definition on the jawline. Here's how I like to do that. So we've done the filler, mostly in the mid-face. Hold this for me. I like to use my white pencil. The white pencil for my physicians and students that are watching, it's really important because it helps to set the expectation on where you're going to be doing the treatment. Now, what I like to do is I'm going to put just a little touch here, and I'm also going to define a little down here. We project the chin. When you project the chin from the front, we look the same. From the lateral and the oblique view, it looks a little more defined. So these are the areas we have 2 syringes of the Bellafill. The Bellafill is the permanent filler, and it feels natural. Her skin feels so smooth. We did some of the Bellafill syringes before, and so that's where I'm going to treat today, just a little bit of numbing, okay? Any questions about our goals?
No.
All right, I'm going to hold this here, and so for my physicians and students that are watching, I like to use the HIPAA cleanse. I'm going to use my Avogard to clean my hands. And then my team has everything set up perfectly, makes it so easy for me. And Tate is our camera person. And we have over 30 staff here dedicated to your care. And exciting news, we're going to be in our new office in about 6 weeks. So keep a lookout that we'll have our new office available and ready. And it's about 9 or 10 minutes south and west from here. I'm going to have you rest your head all the way back. There's no restrictions afterwards. When I do the fillers, I like to tell patients 5-minute massage 5 times a day for 5 days. You cannot hurt the filler the way that we do it. When I use the filler, I like to use the safety cannula. Remember, most injectors out there are beginner or intermediate level. And so you got to be careful and make sure you have someone who is a really expert injector. You don't want them practicing on your face. So you feel buzz, pinch on 3, 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad there.
Small.
Buzz, pinch, 1, 2, 3, pinch. No pinching there. Thank goodness for lidocaine. We let that set in a little bit, and we'll do the other side. Fillers, they're very quick, easy to do, look natural when you have the right injector, of course. 1, 2, 3, pinch. And 1, 2, 3, pinch. And you have your big trip coming up. That's so exciting. You're going to look great for your trip and great for your pictures on your trip. Okay. So now, since I'm using the safety cannula, I make a little insertion point here. That's where because the safety cannula is a blunt tip cannula. And a little pinch here. And that's the entry point for where we're going to inject the filler. Pinch. Good. Doing okay?
Yes, I'm doing fine.
Liz is tough.
Oh my goodness.
I'm trying to make it easier than the dentist's office. So if you're watching, please share this video with someone you know who would appreciate. Let me turn your head this way. I'm going to start with the chin, the melolabial fold here. Twist, twist, twist. The twist technique is very important because, pressure, 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 pinch. You atraumatically advance, pressure, pinch there. You doing okay?
Mm-hmm.
I'm not in a hurry if you need a break. There's numbing medicine inside of the filler, so she'll feel a little pinch at first, and then it eases up. And we're just fanning technique, shiver technique, to put a very small amount of filler over a large area. Patients really appreciate the ability to resculpt the foundation of the face, because as we get older, we lose the bony prominences. We lose skin, muscle, fat. We also lose the bone. Everything's looking good. Pressure pinch. Now, I do some of the injections. I also have my master injectors. Pressure pinch, do the injections. And we work very well together. Get amazing results. Pressure pinch. You doing okay?
Yes, I am.
Small, medium, big pinch there, not too bad?
No, not too bad.
Perfect. I'm going to do a little bit for the jawline as well. Liz will definitely pass the grocery store test today. If she walks into the grocery, no one does a double take. And Liz, can we share how young you are?
Yes, you may.
How young are you?
I'm 58.
58 years young. You don't look it, you don't act it. Let me turn your head this way. And you have many active years ahead of you, so it is an honor to be a part of your care. Little pressure, a little pinch here. Twist, twist, twist to atraumatically advance the cannula into the subcutaneous, subdermal tissue plane. Always fast, but never hurry. Twist, twist, twist. Sometimes I'll use the little needle to get access. There we go. Patience, patience, patience. There we go. And I'll hold the tissue here, twist, twist, twist. We're above the angle of the mandible, and just a little bit. We can always come back and do more. No need to do too much. And my rule is that when I do the fillers, family and friends, they cannot figure out that you did it. You'll look natural. No one's gonna. Every patient says, "Well, don't do too much filler," but we won't do too much. Let me turn your head this way, and you will pass the grocery store test. That's why patients come here, because they want to make sure no one can figure out, and they don't want someone to say, "Hey, you did fillers. I see it." That's why they come to this office at ImageLift. We have our books. They both hit the Wall Street Journal bestseller list. Love to get you a copy. We want to make sure you know your options, because that's really our job, is that once you know your options, you can make the best decisions for you. And a lot of people are unaware of what is possible. Feel a little pinching there. You doing okay, Liz?
Yes, I'm doing great.
Very good. Twist, twist, twist. Patience, patience, patience. And I'm going to turn your head just, there you go, thank you. Twist, twist, twist in the subcutaneous plane. Shiver, 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 a very fine amount of filler over a large area. Also very hard to get the filler into a blood vessel when you use the shiver technique. Very good. Okay, so we're completely done with the filler. Hopefully that wasn't too bad.
No, it wasn't. It was fine.
And so you can see right away how it helps, hold this for me, how it helps to define us a little bit more here.
Wow.
Make a big smile for me, big smile. Looks so natural.
Wow.
You're ready for your close-up. Do you like it?
Very much.
So if you're just now joining us, I want to show you Liz's pictures and brag on her. So she did the local anesthesia, image lift, facelift, the neck and the jawline. She looks great from every angle. We trimmed the eyelid skin. She felt her vision was better, higher apex of the face and cheeks, and wonderful profile, the heaviness of the jawline. And the whole time we've been talking, she was looking at that result. She was looking, looks so good. Any questions I can answer? Normally I would do another 2-3 month follow-up. We want to set an appointment with our esthetician, and she'll talk about the medical grade skincare. We also have IPL. Have you ever done IPL before?
No, and I just spoke to one of your team members.
Oh, Erin, you talked to Erin.
Yes.
So she'll set up all those details. Any questions I can answer?
No, none. Okay, it was excellent.
Congratulations.
I'm very happy. Thank you,
Give you a
Doctor.
hug.
And you
Congratulations.
all need to have this done. You will all be happy. It's all natural, and you look great.
We're so happy that you're happy. And of course, everybody's result is different, but we want to do it the right way for you. So I'm Dr. Rich Castellano, the Smile Doctor here at ImageLift. We're on a mission to stop bad plastic surgery and help you do things the right way. We'll see you in the next video. Give us a call. Send your family member or friend. We'll do things the right way. We'll see you soon. Thank you, Tate. Great job. Great job, Liz.